When something traumatic happens, your brain can get overwhelmed. Instead of storing that memory like a normal event from the past, your brain kind of freezes it. It gets stuck, almost like it's trapped in time. So when something triggers that memory, your brain doesn't say, "That happened back then." It says, "This is happening right now." That's why people experience flashbacks, panic attacks, or intense emotional reactions. The brain is reliving the trauma, not remembering it. But there's a way to help the brain process these memories in a more helpful way. It's called EMDR, eye movement, desensitization, and reprocessing. By using bilateral stimulation, like eye movements or tapping, EMDR activates both sides of the brain. It helps the emotional and rational parts start talking again. This mimics the brain's natural way of processing memories, unsticking the trauma and reducing the emotional intensity tied to it. The memory doesn't disappear, but over time it loses its power to cause distress. It becomes just that, a memory, no longer overwhelming. EMDR is an evidence-based therapy that follows a structured 8-phase process. The first phase is history taking. During this stage, the client will work together with the therapist to identify a distressing memory or triggers and determine goals for the treatment. Next is the preparation phase. This is where the therapist will begin to explain the EMDR process to the client, including the bilateral stimulation strategy they will be using, giving the client an opportunity to practice this. Within this phase, the therapist will provide the client with coping strategies and resources that the client can access throughout the process. Assessment is next. This is where the client will be supported to activate and visualize the chosen memory. The therapist will support the client to become aware of their associated thoughts, feelings, and body sensations, and help assess these. The next phase is desensitization. The client will be instructed to focus on the memory while engaging in bilateral stimulation such as eye movements. Following this is the installation stage. The therapist will support the client to strengthen positive feelings and beliefs about the memory and self to replace the negative ones. The 6th phase is the body scan, during which the client is asked to observe their body's physical sensations while thinking of the memory. This is done to identify any lingering discomfort or negative feelings. The closure phase follows this. This stage is the conclusion of the therapy, where the therapist will ensure the client feels stable and uses specific techniques to ensure the client's safety when disengaging from therapy. The final phase is reevaluation. This is where the therapist will check in on the client post-treatment to review if the effects remain, or to identify any other memories or feelings that may have arisen from the therapy. The EMDR process is structured and follows a standardized protocol. However, it is tailored to each person's needs, and as recovery is unique for each person, the duration and frequency of sessions may look different for every person. When EMDR is delivered by an occupational therapist, it is focused on functional goals. These could be getting better sleep, feeling confident at work, or managing tasks like the grocery shopping. The OT will work with the client to explore which areas of their life feel challenging or are affected by psychological distress. Together they will set goals based on activities and life roles that are most important to the client. EMDR will then be implemented to reduce distress or symptoms that are getting in the way, so the client can re-engage in life and things that are meaningful to them. Since its development in 1987, EMDR has been widely researched and analysed as a treatment for trauma-related conditions. The therapy is supported by high-level extensive literature and clinical evidence and is endorsed by global health organisations such as the World Health Organization. As research and clinical trials continue, EMDR is evolving to be used in a range of mental health settings. It is also shown to be effective in supporting people with a range of presentations, such as complex trauma, anxiety, depression, and other co-occurring conditions.